with renowned experts from meat, dairy, produce, and retail industries, as well as an expert on research funding. Each expert will be discussing the lessons learned and future implications of the COVID-19 pandemic, as well as possible research topics and funding opportunities. Our first speaker is Dr. Ashley Peterson. She has a doctorate from the University of Maryland. She is a native of Kentucky and was raised on a cattle farm. Dr. Peterson is now the Senior Vice President of Scientific and Regulatory Affairs for the National Chicken Council located in Washington, D.C. Combined with her prior position with the American Meat Institute, Dr. Peterson has both depth and breadth of meat industry knowledge. Dr. Peterson will be sharing her personal experiences working with poultry processors and government agencies throughout the pandemic. We welcome and thank you, Dr. Peterson, for taking the time away from your duties and speaking with us today. Please share your story with the audience.
Thank you, Dr. Courtney. Can you see my screen and hear me okay?
Yes, we can.
All right, thank you, Lynn. I appreciate it. And thank you all so much for the invitation to speak with you today. I am going to focus particularly on the broiler industry, as that's the industry that I work with very closely. And so let's go ahead and get started. First of all, for those of you who aren't familiar with the Chicken Council, I'm going to give you a little overview of the Chicken Council itself and kind of set the stage for what's going on within the industry, current industry trends. And then we're going to do a dive into COVID-19. As Dr. Courtney mentioned, everyone has been impacted by COVID-19 one way or the other, and the poultry industry is no exception to that. So first of all, who is the National Chicken Council? The National Chicken Council is a nonprofit trade association that represents vertically integrated broiler producer and processors. Broilers, for those of you who aren't familiar with that term, are young meat chickens. They are not egg-laying chickens. NCC does not represent the table egg industry. Our members produce over 95% of the broiler meat in the U.S., and our job at the Chicken Council is to advance industry policies to Congress, the executive branch, and the media. So as I mentioned, we work in several areas. The first is government affairs. Our office is located 3 blocks north of the White House. And so government affairs plays a large role in the Chicken Council's duties. We represent the interests of the industry in Washington, D.C., and we work to influence the outcome of legislation that impacts the industry. On the public affairs side, we work very closely with the media to correct any negative perceptions that are out there and improve the industry's image. We also work to promote the consumption of chicken. And finally, we have a series of websites that provide a bunch of information to allow you to actually get into a processing plant, a hatchery, and you can find those virtual reality videos on our website. And we always hope to be a resource for those of you who have any questions on the chicken industry itself. I work in regulatory affairs, as was mentioned previously. In my role, I work very closely with the U.S. Department of Agriculture to promote science-based policies for food safety, processing, and labeling. Work very closely with the Food and Drug Administration on animal health topics and the Environmental Protection Agency on environmental aspects that impact the broiler industry. And finally, we work in the area of trade as well in a partnership with the USA Poultry and Egg Export Council to expand the footprint that the U.S. chicken industry has globally. So if we look at the current industry, there are about 29 companies that are involved in raising, processing, and marketing chickens in the U.S. We have about 25,000 family farms that have production contracts with those companies. And as I mentioned, we represent about 95% of the broiler chickens that are raised in the U.S., which are raised on those family farms. In 2020, we processed about 9.25 billion, yes, that's with a B, broiler chickens in the U.S., weighing almost 60 billion pounds of live weight. And that's more than 45 billion pounds of ready-to-cook chicken that was marketed. The U.S. has the largest broiler chicken industry in the world. In 2020, we exported about 16% of our production. We are no longer the leading exporter of chicken. Brazil is the leading on volume, but we are second. And Americans consume more chicken than anyone else in the world, more than 98 pounds per person per year. That's a lot of chicken. So if we do a comparison between 2002 and 2020, it's interesting to see how there's been some production shifts. If you look at 2002, the top 20 chicken companies produced about 90% of the entire U.S. production, and that's about 153 million birds a week. If you look at those same top 20 chicken companies in 2020, they produce about 98% of the entire broiler production, about 168 million birds per week. If you focus in just on the top 10, they're producing almost 80% of the entire U.S. production and processing about 140 million birds a week. The one thing I always like to show is the breakdown of production systems within the industry. This is data from 2012 through 2020 from the Ag Marketing Service at USDA. And it's interesting to see the shifts from conventional production to no antibiotics ever production, which just goes to show that our industry is very nimble and works to meet the demands of our customers. Just so you know that this data represents the birds that are marketed in each production system and not necessarily raised in each production system. There has been a decline in 2020 in ABF and organic birds marketed, and that's more than likely due to COVID-19 and impacts in processing plants specifically. And if you look at the production, it is down about 2% for ABF production over 2019. But if you look at overall production for between 19 and 20, it's relatively unchanged in the total number of heads processed. So why we're here today, to talk about what happened. This is a picture from my local grocery store in March. You can see that there's really not a lot of options sitting there for the consumers. And I think this was the first time, definitely in my lifetime, and probably a lot of yours as well, that there were food insecurities. There were empty shelves. It's one thing before a snowstorm when the milk and bread are kind of picked over, but this was a whole different situation that we faced. One picture that I also took, this is the exact same day, was the plant-based the plant-based proteins. There were still plenty of plant-based proteins, but people were really gravitating towards ground beef, chicken breast, products that they were very comfortable with cooking in their kitchen. So the meatpacking and chicken processing industries were certainly on the sorry, something popped up on my screen. The industry was certainly all over the media from a whole variety of standpoints. One of the questions was, can you get COVID from eating meat from plants where there have been COVID cases? The answer to that is no. USDA, FDA, WHO, everybody agrees that that's not the case. There were lots of investigations in various plants because of outbreaks. There were some discussion about why meatpacking plants were considered to be hot spots. There was an executive order issued by President Trump to make sure that processing plants stayed open, and we're going to talk a little bit more about that. And of course, there was, with the supply chain disruption, it would be great if we could ask our cows not to produce milk, and if we could ask our chickens not to lay eggs, and we could ask everybody to just hit the pause button, but that's not the reality of livestock production. And so there were some depopulations that had to happen in order to manage supply chain. So when we talk about supply chain, we have to look at the breakdown between food service and retail. As I mentioned earlier, the retail market was slammed immediately in March. and the food service industry almost essentially disappeared overnight. And if you look at the breakdown in chicken production, retail represents about 54% of our production, and food service is 46. So when 46% of your market, or almost 46% of your market, dries up overnight, we have some supply chain challenges, as we saw and will continue to talk about during this presentation. So like I said, with the meat shortages or the perceived meat shortages, there were lots of people who were very anxious to get chicken. And these are some pictures of cars lined up at various chicken sales in the state of Delaware, specifically, because that's where I live. And people were lined up for miles and miles and sitting for hours and hours in their car waiting to get a 40-pound box of chicken. And it's amazing how many people, one, showed up for this, but two, how very thankful and grateful everyone was that participated, not only from the people volunteering to hand out all the chicken, but the people who were coming through in droves in order to purchase some chicken for their family. So this is some data from the U.S. Census, and if you look at U.S. food spending over time, the grocery store line is in orange, and eating and drinking places, so more on the food service side, would be in blue. And you can see very clearly that in early 2020, grocery store sales went up significantly, and eating and drinking places plummeted, as was no surprise, because in many states, these establishments were going to be doing carry-out options only. They only allowed for a certain number of people to sit in their restaurants, and there were definitely some hiccups along the way. If you go specifically to retail and you look at grocery sales, this is through 2020 through the end of December, you can see that the meat department increased over 50% in sales in the month of March. You can also see that total store sales went up by about 40%. Remember, everybody's eating at home. Kids are at home. You've got to make lunches. It's not like sending your kids to school and they get their lunch at school. Everybody's at home. Everybody's eating 3 meals a day at home. So grocery store demand was insane. The fresh perimeter really increased as well. Again, that's fruits, vegetables, dairy, meat, poultry, all increased. What I found was interesting is that the deli department was only up about 9 to 10%. I would have thought that, given that that's a convenience item, that would have increased a little bit more than it did, but it only went up early in COVID by about 10%. So again, this looks at very similar, this is retail grocery sales growth. And again, total store sales were up significantly early in March, and actually have remained up throughout almost the entire year, because there are still food service entities that are working to get back online. There's still capacity limitations at those restaurants. And then if you look specifically at the retail meat case, the growth in 2020, we see a significant volume increase by about 50% in March. Again, at the beginning of COVID, when there was a panic and let's fill the freezer, that was the case across the U.S. And so again, as the industry worked to shift production from food service to retail, the panic, I would say, decreased as the availability of protein increased over time, and there wasn't quite the hoarding that was going on early in COVID. But you can certainly see that growth in retail meat has continued really throughout the entire 2020. And specifically on protein demand, of course, as should be expected, you would see a significant increase in beef, because ground beef is a very common, easy to cook, and so is chicken, very common and easy to cook protein. So we saw increases in both price and volume throughout the 2020 calendar year. So where are we right now? How did we get shelves stocked again? Well, I think, as I mentioned, You don't see the hoarding that you had early on. I love this picture. It's 2 pallets. I must have gone to Sam's or Costco. 2 pallets of toilet paper. As you all probably recall, you couldn't find toilet paper or cleaners, or I like to bake. I couldn't hardly find flour at the store. So again, just totally different shift from where we were pre-COVID and pre-March of 2020. Restaurants are slowly opening, and so we are able to get protein back into restaurants. That is slow. It just depends on what state you're in, because every state's doing things a little bit differently, and we're going to talk more about that once we get to some of the disruptions that happened within the processing plant specifically. Restaurants have diversified. They've been able to do carry out a lot better than they did back in March. A lot of restaurants are not meant for carry out. A lot of foods may not be meant for carry out. So there had to be some changes. And then we also had some assistance by the Food Safety and Inspection Service on labeling. There are certain labeling requirements for products, specifically meat and poultry, going to food service as it is compared to going to the grocery store. And so we were able to get some assistance from the agency on allowing some flexibility. So if you saw chicken or meat that had a different label on it, it may have meant that it was initially supposed to go to a restaurant and it made it to the grocery store shelves instead. So one of the challenges that we had early on in COVID is finding a balance between all of the entities that regulate or have oversight of a meat or poultry plant. CDC came out with their guidelines in April. We had the executive order, which we're going to talk about in just a moment, for the U.S. Department of Agriculture. We had different states. We had local health departments saying that an establishment needed to do X, and a state health department that said an establishment needed to do Y. And then the governor of that state had yet a different way of looking at how things should run. And so there were definitely some challenges early on in making sure that, one, we did what we needed to do to make sure that our employees were safe. We did what we needed to do to make sure that we could continue to supply protein, because people out there were not necessarily always finding the protein that they wanted to take home to their families. And so again, making sure that we could find that balance was definitely a challenge. And when you complicate that with various health departments or federal entities suggesting that an establishment do things a certain way, that was a challenge. And we definitely learned a lot as we went through that process. So as I mentioned, then President Trump issued an executive order on April 28th. And essentially it said, under the Defense Production Act, that during the state of emergency, meat and poultry plants had to fulfill their contracts, and that you had to be compliant, and you had to have documented compliance with the OSHA and CDC guidance. And so that gave, the executive order was never used per se to keep plants open, but it was a way to make sure that we could continue operating and making sure that the meat cases were full. So one thing I want to mention is that worker safety is not something that's new for our industry. This was a picture well before COVID, and you can see that we have lots of, yes, people are working close together, but we have a lot of PPE being used in our plants well before COVID, including bump caps and goggles and gloves and chainmail and hair nets and face masks and things like that. So those things were already being deployed to our employees to make sure that their safety was maintained. And as I mentioned, CDC and OSHA came out with guidance specifically for meat and poultry processing workers. And one of the things that has been discussed and has been discussed in the media and elsewhere is social distancing. Of course, as we saw the picture before, people aren't necessarily working 6 feet apart when you debone a chicken, for example. And so one of the things that we were able to do, and that was implemented across the industry, and I would say even before this guidance came out, was putting partitions, physical barriers between employees and across from employees to make sure that not only did they maintain their safety, but that the safety of others around them were maintained as well. And so this information came out from OSHA, like I said, in April, and the industry worked diligently to make sure that they were complying with all of these. We do expect this guidance to be updated in the near future, and so we look forward to those suggestions as well. So as I mentioned, protecting our employees is the top priority for our industry. And we do have an interesting challenge, I would say, when you look at our industry, the meat and poultry processing industry versus other manufacturing industries, is that we do have a lot of people in a specific space. And if you look at our industry, we're a little over, the U.S. average is 1.2 per 100 square feet, and we're over 3. And so, yeah, we are higher than others. But there are things that we were able to do as an industry very quickly in order to make sure that our employees were safe. The barriers I already mentioned. We expanded the PPE use in our plants. Temperature screening was something that was initiated early on to make sure that anybody that may have had any symptoms were not allowed in the plant to potentially spread it to other employees. Expansion of hand washing stations, sanitizing stations. Sanitation in general is something that we do anyway as part of food production, but we did increase the frequency and intensity of sanitation in common areas, common touch point areas like a microwave or a vending machine, things like that that do get a lot of traction. Signage and messaging to make sure that everybody was aware of best practices. Most of our facilities have on-site nurses anyway, but they were very busy asking questions and making sure that everybody who was coming into the plant did not have symptoms or had not been exposed. So I want to run through a few pictures based off what we already talked about on personal protective equipment. Again, people with face masks, gloves, smocks, and ready to go into the processing plant. Enhanced sanitation. One of the things that our members did that I thought was very good was have a team just dedicated to sanitation. And so they would be in break rooms and going into locker rooms and other common areas. And their sole job was wiping things down, making sure things were clean. Another thing that a lot of our establishments did was do a deep clean every weekend. Most of our plants run 5 or 6 days a week, and so on that off day, there would be a deep clean across the plant, and not just common areas, but everywhere. So here are some pictures of some of the dividers that I mentioned earlier. These are dividers that are between individuals, and then on the top left you can see the divider or partition that is across the debone line as well. And yet another picture of these barriers in our processing plant. Here's a picture of a break room where plexiglass dividers were put in place so people could still sit down with their buddy and have lunch and talk. And then outdoor break rooms. So that was another thing to make sure to help the social distancing, staggering breaks and making sure that there was enough space that everybody could maintain their distance and still enjoy their breaks. Temperature monitoring, that was something that is now, for the most part, standard across the industry, that everybody that's coming to a plant has their temperature monitored. And we talk a lot about, is this the new norm for the industry? And it very well could be. There's nothing wrong, regardless of whether it's COVID or anything else, to make sure that people who aren't feeling well stay home from work. And then education and communication. We have employees that speak a variety of languages throughout the industry. And it's really important that everyone understands completely what the best practices are. And CDC has been very helpful with putting these infographics together. And so this, the Haitian Creole and Vietnamese, two examples. And so again, we have a very diverse population that works in our establishments. And so these were very important that we put signage that we put on the walls, and so that we could, again, make sure that if people were carpooling, they knew the best practices. If people were not feeling well, that they knew to stay home, and making sure people were washing their hands, and basic communication like that. One of the other discussions that we got into was around testing, whether it should be mandatory or voluntary testing. And this was something that we're well past this point now. But at the time, there were lots of discussions about, do you make it a mandatory that you have to be tested before you come into work? Now, certain health departments did require 100% testing of all employees at a certain frequency. I can't imagine, I've never been tested, so I don't know if you all have, but sticking something up my nose once a week really doesn't sound very entertaining to me. But there were lots of discussions about whether they should be mandatory or voluntary. And I remember a conversation that I had back, I guess it was in May or June, where they were debating on whether they were going to put a mandatory testing program in place. And they were talking to some of their employees, and they said, well, why didn't they decided not to do mandatory? And they said, well, why didn't you get tested? And the guy said, well, if it was mandatory, I would have, but it wasn't. And so again, you know, just some lessons learned on whether or not going either way made a lot of sense. And a lot of this was driven by the health departments at that time. So where are we kind of today on the vaccination front? You know, our employees are essential workers. And we have about 30 million frontline essential workers in food, and that includes first responders and U.S. Postal Service workers, grocery store workers, but our industry makes up a good portion of that. And so one of the challenges that we're seeing now is availability of vaccinations. Every state has been doing their own rollout of vaccinations, so whether it's a availability issue or an implementation issue, I'm not sure, but I know the state, I live in Delaware, as I mentioned. Delaware is a little bit behind some of the other states. And so we have employees who are going, you know, driving across state lines to get vaccinated in neighboring states because some people are interested in getting vaccinated and not everybody is interested in getting vaccinated. That's been another interesting caveat to this whole discussion. So I pulled this from CDC's website this morning. About 22% of the population has had at least one dose of the vaccine, and 12% of the population is fully vaccinated. If you look at over 65, again, that's been the focus of the initial rollout, was the older population. If you look at that, about 65% have received at least one dose, and almost 40% are fully vaccinated. It's been very interesting to watch this data change over time and as the vaccine rolls out. And now that we have the Johnson & Johnson vaccine, you can get one shot and be fully vaccinated. So I also pulled this morning. If you look at, this is from the New York Times, and they've been tracking COVID case counts over time. We are down 15% in cases over the last 2 weeks. We're down 32% in deaths due to COVID, and we're down 23% in hospitalizations. So we're hopeful that that trend continues. Of course, we are watching very closely the new variants of COVID that are coming out, and what is that going to do to impact not only the meat and poultry sector, but the U.S. in general. And then specifically, if you look at meat and poultry COVID cases, yeah, May was a challenging month for the industry for sure. Lots of cases in the month of May, and then over time we have seen that decrease. Of course, there were There were upticks after, 1 to 2 weeks after a holiday, you saw an uptick, whether that was Mother's Day or 4th of July or Halloween, Thanksgiving, you always saw an uptick after a holiday. But if you look at last month's average, so February 2021, we were at about 96% less than where we were in May of 2020. So what this tells me is that the strategies that the industry put in place worked, and we were able to decrease spread, and let's hope that the vaccine rollout also helps us keep running those numbers down, and so our average is going to be lower over time. The one thing that's important to mention is that as we have these new variants, it's going to be interesting to see how this data shifts, and whether or not the vaccine is going to be responsive to those variants as well. So a few questions that I get asked specifically are these implant changes the new norm? I would say more than likely yes. Whether it's COVID or any other sort of virus or health condition, I think that it's important that, if these are working to help control COVID, it may help to control the flu season and spread of other similar viruses over time. Supply chain, my assumption, my guess, I'm not an economist, but as states start reopening, as restaurants get back into full capacity, as kids go back to school, I think people are tired of being cooped up. I think people are tired of cooking at home all the time. I think people want to go back to reality. They want to go on vacation. They want to do something. So I'm guessing that the protein supply is going to be in good condition moving as we get further into 2021, especially as we increase the number of people who are vaccinated in the country. We do have two things on our radar that we're watching very closely. One is a national emphasis program out of OSHA, and that is going to focus on manufacturing sites that have a higher, or entities that have a higher rate of COVID. So that's going to be healthcare, that's going to be long-term care facilities, and that's going to be meat and poultry processing. So something for us to watch. The other thing that may come out in the near future is an emergency temporary standard, which would make some of the standards that are in place enforceable per se. So if you had an establishment who did not put these barriers in, for example, to protect their employees, then that changes the dynamics of this emergency temporary standard. We also already mentioned the variants, and we talked a lot about the vaccination rollout. So again, very hopeful that continues to be successful over time. And it makes us really think closely about automation. With automation, you need fewer employees. You don't have to worry about a piece of equipment getting COVID. You do have to worry about it breaking down or not functioning properly. But automation is certainly something that I think COVID has opened our minds to even more than it had before. Virtual auditing is another thing that I think has become much more commonplace, where early on people weren't going into meat and poultry processing. They weren't going on farms to do welfare audits. And so if you can do that on a virtual format, maybe that works. Maybe that works just fine. Enhanced imaging systems, again, replacing the need of somebody sitting there seeing something and having a computer actually do that imaging itself. One thing that we did put together at the Chicken Council was a big thank you to all of the folks that are involved in chicken production. Lynn Taylor is going to put a video in the chat box for you all to watch at your convenience. And again, this just goes through some of the things that I've already talked about, but then thanking our frontline employees for their dedication and for helping us through these very challenging times. So with that, Dr. Coatney, I will turn it back to you for any questions.
Well, thank you, Dr. Peterson. I just want to make a quick announcement. When folks submit a chat question, make sure that you post it to everyone. That will give us a better idea of what kind of questions are out there. And Dr. Maruf has some questions he'd like to share with everyone that we pulled together. Now, I know we've only got about 10 minutes, Dr. Peterson, so there's a whole list. I guess it's a laundry list of quick questions. You could just pick a few that might give you a minute to discuss. Thank you.
All right, yes, I am a little long-winded, so I'm sorry I went over. I'll start with number 4, I think. Lack of coordination. I think one of the things that we all need to do, and this isn't necessarily just the poultry industry, but I think that, you know, we didn't know that this was coming, so we didn't have a pandemic plan in place. And I think that it's really important that after this is over, that we do some tabletop exercises and figure out what that looks like. Now, it's going to be different depending on the situation. You know, COVID is very unique. It's not like other viruses. It's not like other issues that we may run across. But I think it's important that we get together with local health departments, federal agencies, and try to be on the same page as much as possible, so there isn't quite as much back and forth, and that we can, you know, if we've got a program in place, we execute that program and get the ball rolling on that. I think that would really be helpful. That didn't solve our situation early in 2020, but you know, that's what I would like to see. So let's see, the question number 2, I'll bounce back up. Is the data being presented only for members of the organization I represent? Does it account for producers who sell directly to consumers? Okay, that's a great question. The information that I presented, and it depends on what data you want. All the data that I presented is publicly available. There's nothing that I don't have any magic data. I wish I did. But I don't. So it's all publicly available. Most of it is from what now the IRI data is probably not going to be for a producer who sells directly to a consumer through a farmer's market. That's not going to be incorporated in that. Our members are the larger entities who are, you know, going to be like a Tyson or a Pilgrims or Purdue or Sanderson Farms that go, whether they go to retail or food service, you know, that's kind of how their production flows. Question 3, do I have any idea on what percentage of the market direct to consumer sales represents? My guess is it's less than 5. It's probably less than 2. Again, that's an estimate. I could find out, but if I'm just going to grab a number, I'm going to guess it's relatively small from a volume standpoint. Let's see, the first question, we'll go back up. What are some of the changes from facility design perspective employed by the meat and poultry packing industry in response to worker safety? So facility design, that's one thing in chicken processing. In first processing specifically, where the birds are eviscerated and chilled and inspected, you know, that is all very automated. There are people there, but they're already socially distanced, so they wouldn't be necessarily 6 feet. So they would be 6 feet apart anyhow. I think that, you know, we always wish we had bigger footprints. We always wish that our establishments were a little bit bigger, and that we could make room for some of these changes. But from a facility design perspective, my guess is, unless we're doing some serious retrofitting of our existing establishment, our footprint's probably not going to be big enough to do an overall facility redesign. But I do think that automation is going to play a big role in this moving forward, where some of those, like a debone equipment, could be put in place. And it doesn't necessarily change the productivity. That kind of goes to the next question. It can. The bigger issue with some of this automation is the precision. And so nothing beats a human doing a cut on a chicken. That is an exact science. And if you've watched anybody work on a debone line, it is amazing how talented these individuals are and how exact they are. And unfortunately, you know, as much as we try to make every bird that goes through the plant exactly the same as they do in other industries, it doesn't. And so right now, hopefully with the help of some imaging systems, imaging technology, we'll do better, but yield can be impacted if we use some of the automated equipment versus versus a human. But I do think that from a long-term solution, that was the third part of that question, absolutely, that's probably going to be something that's more widely adopted, you know, moving forward. The last question on here was, does the industry intend to keep these practices in place? And I would say, for the most part, yes. I see no reason for us to make a lot of changes beyond that, because as I said, if it's not COVID, it may be the common cold, it may be flu season, it may be something else that we have to address. And I think whatever we can do as an industry to make sure that our employees are safe and they're comfortable coming to work, then that's exactly what we need to be doing. Are there any more questions? I think I went through most of these.
Well, I have one for you, Dr. Peterson. It's my understanding these plants are kind of geared for this big bird production, which goes into further processing for chicken fingers and that sort of thing. And then there's a tray packed type chicken. They're a smaller animal. Is the industry thinking about conducting any feasibility analyses on how can they shift their production in any way? Because I think the big birds were going largely to the we're going into the restaurants and that sort of thing, where the small birds are going largely to growth. Could you speak to that?
Yeah, and so I do think that some of the establishments shifted. It takes time because, you know, you need a smaller bird, and if you are set up to raise an 8-pound bird, for example, that's a lot different than raising a 5-pound bird that may go to, you know, KFC, for example. So I think that, yes, I know during COVID that there were some plants that made these shifts, but it does take time, again, just because you know, your setup is for an 8-pound bird. And so for you to make those changes, whether that's through your feeding programs, that's through, you know, changing your stocking densities and your plants, changing how you process the birds, because again, now you're looking at the same speed of birds going through the processing plant, but now we went from an 8-pound bird to a 5-pound bird. Again, just some of those logistical changes can happen, they just take some time.
And with chicken production, it's a very fast process from conception to processing. And with the perishability of that, it's hard to stand or withstand disruptions, because it's not as though you can hold the chicken in stasis. Could you speak to that? Is that kind of the reason why we saw some limited euthanasia?
Yeah, I think that's part of it. I think there were a couple things. One, we really tried to slow down where we could, especially in those areas that were impacted by COVID, and people, you know, they were having to drop shifts and they were having to be out for a couple days, or they had to shut production down for a couple days. There are some ways to slow down the growth of birds, feeding programs and lighting programs. But for those areas where, again, the processing plant just had so many challenges and they could not take the number of birds that they were used to processing, then there was some depopulation that unfortunately had to happen. Of course, that's in nobody's best interest, and very unfortunate situation. But, the industry, does at times, we can work with our neighboring processor that may process birds for us. And we see that when we have like natural disasters. When you've got a hurricane that comes up and hits North Carolina, for example, you may have flooding in a certain area, and birds that are in that area can go, a little bit further away to be processed. And the industry really comes together in order to make sure that, the welfare of our birds are maintained. And that's extremely important throughout this entire process.
Well, thank you, Dr. Peterson. We appreciate your insights, and we applaud your presentation. It was very good and very informative.
Thank you so much. Thank you for having me.